Okay. So I recently had a patient with severe adenomyosis. Adenomyosis is a condition which is very similar to endometriosis, where the lining of the uterus, instead of just shedding, also pushes its way into the muscle wall. And so typically it occurs in your 40s. It can occur earlier, have very heavy, very painful periods. And a lot of women, if they don't respond to the Mirena hormone-containing coil, will end up with a hysterectomy because they have erratic bleeding, heavy bleeding, painful periods when having had years of no pain. So these women, often I do a keyhole hysterectomy and things like that. And I've had quite a few patients, but the most recent patient rang, so we were having a follow-up to decide about her surgery. And she said, you know what, Mrs. Bajekal, you mentioned that I should try and adopt a plant-based diet. I've been following you on Instagram. I have been using all your recipes. And actually, can you take me off the list? And this was about a year ago. And now so her periods got regular. She cancelled her operation for hysterectomy, and her MRI scan actually showed such a big shrinkage of the adenomyosis. Now, not everybody's going to see that, but this is, one of the stories.
Welcome to Afternoon Tea. I'm Dr. Linda, if we haven't met before. I'm an emergency physician from Sheffield, and I'm here with my lovely co-host, Dr. Erica, who is a GP from the West Midlands, and we are both lifestyle medicine doctors.
Hey everyone. So did you know that 89% of deaths in the UK are caused by lifestyle-related chronic illnesses? And as a society, we have come to view chronic diseases as the norm, but this doesn't have to be the case. And actually, your genetics are not your destiny. Linda and I both used lifestyle medicine and nutrition to help our patients to combat and manage their chronic diseases. And Afternoon Tea with Docs was born out of our shared passion to empower everyone with these lifestyle and nutrition practices, our experiences, and also the knowledge of our expert guest speakers, so everyone can live a long and fulfilling life. And if you haven't met us before, you can connect with us on Instagram, Facebook, and watch the replays of our previous sessions on YouTube. And we are here for Afternoon Tea every Sunday at 5 p.m.
And today we are so delighted to have Dr. Nitu Bajekal joining us in the conversation about endometriosis and polycystic ovarian syndrome. Dr. Nitu Bajekal is a senior consultant OBGY in the UK with over 35 years of clinical experience. She's a fellow of the Royal College and recipient of the Indian President's Gold Medal. She is one of the first US board-certified lifestyle medicine physicians in the UK. She has written the Women's Health module for the first UK university plant-based nutrition course. She is the founder of Women for Women's Health, a voluntary service set up to educate, energize, and empower women to make lifestyle choices to help improve their own and their family's health. Dr. Bajekal is passionate about educating women, providing reliable medical and lifestyle information for the general public, doctors, workplaces, and schools. She's committed vegan, personally benefiting from this wonderful lifestyle. Welcome, Dr. Nitu Bajekal, and happy Mother's Day to you all.
Thank you, and happy Mother's Day to all of you. As I was telling you before, Erica and Linda, that to be a mother, you don't have to have had your own baby. It could be a fur baby. You could be mothers to, other people that you nurture. And I think that is what a mothering role is. And so happy Mother's Day to all of you. And it's so exciting because you're from Sheffield. I did a lot of my training, my minimal access fellowship and my senior registrar and lecturer post from Sheffield, from Royal Hampshire, as well as from Jessup. So yeah, that's really nice.
Wonderful.
And Erica, you were just saying about 89% of chronic lifestyle diseases affect people, and most of the deaths, dementia is the commonest cause of death now in women in the UK. But there's no aspect of women's health that does not benefit from lifestyle changes. So when people think it's only diabetes or heart disease or cancer, actually there's no aspect of women's health that won't benefit. You may not, completely reverse any particular condition, whether it's diabetes or heart disease or endometriosis, but always lifestyle has a role in every single situation, whatever your age, whatever your stage.
In the 35 years that you have practiced, have you seen changes in the trend of endometriosis and PCOS, polycystic ovarian syndrome, due to the changes in the environment, changes in people's lifestyle?
Because both endometriosis and PCOS were areas of my special interest, I used to see more patients anyway. But I think over the years, several factors are responsible for an increased incidence. One is more awareness, which I love. The fact, because it can take up to 8 years to diagnose endometriosis, a condition where you have tissue which is very similar to the lining of the womb that sticks itself outside. Some women can have very painful periods, others may have no symptoms at all, but whatever it is, there is awareness which has increased. So I think that is making more women come forward. The second thing I think is that there is a delay in childbearing, which is, in many ways advantages, because women are able to follow their dreams and things and not just be, reproductive or baby making machines if that's not what they want to be. And so I do think that a delay in childbearing, while it has positives, that, evolution wise, we were meant to have maybe, I don't know, a handful of periods, about 20 periods in our lifetime. If you think that we started our periods at the age of 14 and stopped, in our 50s, most women didn't live that long because they would have, 10 or 12 children. They would be either pregnant or lactating. While now we have lots of periods. And so that increases all the estrogen fueled conditions, such as endometriosis, polycystic ovarian syndrome, ovarian cysts, heavy periods, painful periods. So, the fact that we have delayed childbearing, we are more aware of it, as well as environmental factors. I think there are some suggestions. We don't know enough yet, but I do think environmental factors, the use of pesticides, these are all things that we don't know enough about, but they probably are playing a role, because certainly we do see women, with more women nowadays with the condition, but partly also, I think, awareness and doctors looking for it.
But unfortunately, based on the endometriosis charity, on average, it still takes about 8 years to diagnose endometriosis.
Absolutely. That is why it is so important. But I'm comparing to, say, when I first started 40 years ago or 35 years ago, the awareness is more. That doesn't mean to say women themselves are not having to, suffer much longer. There are still huge numbers of women who are not or people who menstruate, to be more. I think we need to be very clear that while we use the word women, I want to be very clear that actually we want to include everybody, however they identify themselves, if they have a uterus, if they're menstruating, then we are talking really, when we use the word women, that's what I'm actually saying, is that it involves everybody. And I think that for a particular person, it can take very long to diagnose, but there is more awareness amongst, young doctors like y'all compared to people in our time, where endometriosis and PCOS wasn't really even talked about. It was very vague, and it's still a huge issue, but there has been some progress, I would say, but progress, it's not anywhere perfect.
It takes so long for the diagnosis to happen. And what does that then mean for the women who are suffering with the symptoms to have to wait so long for a diagnosis?
So one of the symptoms of endometriosis is painful periods, okay? And what happens in this sort of situation is often it has been normalized because women have never been given that sort of listening ear or that position where they can talk and say, I am having pain. It's been normalized. Oh, it's quite normal to have period pain, or it's fine. You will be better once you have a child. And when you make those sort of statements, what happens is women themselves get confused. Maybe this is normal. Maybe I should just put up with it. And so there's a difference between the type of period pain as well. If it's just on the first day and it settles in a few hours, yeah, it's unlikely that you've got endometriosis. But if somebody has got symptoms of the pain starting quite a few days before, and then either getting worse or getting better once the release of the blood is there, that could be a sign of endometriosis. If there's a family history of endometriosis, if somebody's taking long to get pregnant, often women will get diagnosed with irritable bowel syndrome when actually what they have is endometriosis. So they may go and see their GP or a colorectal surgeon who won't think about it, or a gynecologist who might think they've just got painful periods and then reassure them without actually delving into, you don't have to always examine women. You can just get a lot of information just by listening to the woman. And that, I think, is lacking sometimes. We are always in a rush. We say, oh, we have only 10 minutes to see a patient. But the truth is, if you spend time in the first appointment, the likelihood is, and you empower that person with resources, with the knowledge that they should go and do some homework, you're there to help them, then you will actually save a lot of time in your practice where they don't keep coming back with questions or where repeatedly coming back to see you. And that is time well spent. But if you don't think about it like that, you see, I just love everything I do. And what happens sometimes is not everybody might be in that position. So they are feeling that I don't know enough, or this person is coming back too many times complaining of the same thing. I'm going to send it to another department and another department. And don't forget, the diagnosis of endometriosis usually rests on an invasive procedure, a laparoscopy. So even I don't want to unnecessarily subject a woman to an invasive procedure, even though I'm a laparoscopic surgeon, even though I'm a keyhole surgeon. I need to make sure that the person really wants it. Is she going to try anything else, to see whether, like a trial of hormonal medication to see whether her symptoms improve? Is she, wanting to get pregnant? Is she looking for contraception? So many things come in. But the main 8 years or 7 years that we talk about is because nobody is talking about it. It's not that you've entertained the diagnosis and then said, actually, you may have endometriosis. Let's do A, B, and C, rather than never talking about it, saying, oh, you actually just have painful periods, or you have irritable bowel syndrome, or it's all in your head. It isn't. And that is the difference, that we are not listening to what people have to say. And I think therein we lose a trick as doctors and as healthcare professionals, because, people have a lot, but most people don't want to spend time repeatedly coming to doctors. They don't have that. Nobody has the time to do that, when somebody keeps coming back or saying, oh, why have I got this pain? Even if the pain is we are not finding a cause for the pain, doesn't mean that the pain is not real. You understand? So, and also yes. Endometriosis is also not diagnosed by everybody. So you have to be quite expert. So you might put a laparoscope in, you may put a keyhole camera in, but if you're only looking for the burnt out spots, if you're only looking for the classic signs of endometriosis, you're going to miss all the subtle signs of endometriosis. And then you will tell the person, you actually don't have the condition. So then you're letting that person down again, and she continues to have her symptoms. And even if you can't see any changes and the pelvis is completely normal, the way you tell somebody that we didn't, rather than saying, oh, we didn't find anything, you're completely normal, doesn't help a patient. What you say is, we couldn't find a cause for your pain. Mm-hmm. That doesn't mean to say you don't have the pain. It just means that Western medicine hasn't developed the tools to diagnose all conditions, including endometriosis. There is a lot we have to learn. So when you empower women with that knowledge, then they know, okay, what can I do to help myself? That's what they're going to do. And who should I see? Listen to your body and say, okay, I am not happy with what this doctor said. I need to go maybe and find somebody who actually understands what I'm trying to say. But I think a lot of it comes from being brushed aside and women feeling they don't want to make a fuss. Most women don't want to draw attention to themselves. They're busy, they have got careers, they don't want to take time off from work. They're made to feel, women take about 9 days. Painful periods are the commonest cause for women to have to take time off, and they often have to lie about what the reason is. Why should it be? It's a phenomenon that happens to us. We shouldn't be hiding our tampons and our pads and saying that we are actually in pain.
Yeah.
I think when you don't take somebody seriously, you create so much more hurt and harm that you then defeat the whole purpose, because, the mind is so intimately connected with the body that if you are somebody who's going to be always dismissed, you're going to think, what's the point? What's the point of me going and seeing anybody? They're not going to take me seriously. You understand? So I think that's why education of the public, education of schoolgirls, I feel so passionate because, historically, doctors have always been gatekeepers of information. We will decide what we tell our patients. I'm sorry, who are we? We are not here to stop information being available. We knew that smoking caused issues, right? Smoking caused cancer. We knew that for years before. We continued to smoke as doctors, and we continued telling patients, it's fine, smoke the slimline cigarette, do this, do that, rather than saying, actually, there is an issue. We didn't share that information. And that's why, in many ways, I am pleased with social media. I am very pleased with the internet, because much as there is a lot of misinformation and fear mongering, I think it is a place where people can really educate themselves from scientific, reliable sources, which we didn't have before. We want our patients to question us. We want the public to question us. We have to be held accountable. I feel, otherwise you're not doing your job,
This is exactly why we're here every Sunday, 5 o'clock, to do this work and to empower people with the knowledge, so that they can make, everyone can make an informed decisions for themselves. And doctors are not here to preach. I don't have right to preach, but I can impart what I have learned in my journey from, as a medical student and throughout my career as a doctor, things that I have learned and through my experiences, impart the knowledge to empower people.
And that's the beauty about lifestyle medicine. The fundamental difference between lifestyle medicine and Western medicine or conventional medicine is that both of them are based on science. Both of them are based on facts. But the difference is that in the traditional or conventional Western medicine, you and I and Erica are all the drivers of the treatment. We decide, you, Linda, decide, you, Erica, decide, I, Dr. Bajekal, decide, rather than, the patient being in the driving seat. The patient needs to be in the driving seat. And that is the difference. In lifestyle medicine, the patient decides, what is going to be decided. They are engaged completely in their treatment, while the rest of the situation, if it's endometriosis, I say, here, have the pill. Have surgery, instead of saying, what do you think? These are the options. This is what I can offer you. This is what I can offer you with lifestyle. This is what I can offer you with the conventional medicine. Maybe you want to do one or the other or both. And that is where the difference between lifestyle medicine and conventional medicine is, that the patient decides. The patient is in the driving seat, and we are just the guide, not the drivers.
How does a patient know that they might be having endometriosis? What are the signs and symptoms that they should be looking at? And if by chance they run into a doctor who is not picking up on that, how can they guide the conversation in a helpful way for both patient and doctor, Dr. Nitu?
So the first thing to understand is, what is endometriosis? So endometriosis is a very complex condition, but is estrogen fueled. So although you will have symptoms that can go into the menopause and create trouble from the scarring and the adhesions, it is an estrogen fueled condition. So you see more women, most of your patients would be in the reproductive age. Okay. Mm-hmm. So from the time they start their periods, 12, 13, 8, from the age of after 8 is when you can, start having periods, until you're 51, which is the average age of menopause. But, if you have menopause later, then it'll take it later. but it's a very complex condition in that we don't exactly know what causes it. We don't understand why this tissue that looks like the lining of the womb, every month your period gets shed as the lining of the uterus gets shed as a period, because it's a failed pregnancy. Pregnancy hasn't occurred, so the lining gets shed. Now, for some reason, some of that lining, which looks very much like the endometrium, gets stuck on ovaries, on the fallopian tubes, on the back of the uterus, on the bowel, and sometimes it can go to your nose. It can, if you have a cesarean section, it can come on your scar, either in your uterus or on the skin. It can go on your episiotomy, which is the cut that is made. Sometimes when to deliver your baby, you may deposit tissue there. So you can have endometriosis in the lungs, you can have nose bleeding. So you can't just say it's the blood that comes out of the fallopian tubes and sticks itself outside. It can be so many reasons. So many theories have been put forward. But the most common pelvic symptoms of pelvic endometriosis tend to be either no symptoms at all, and the first time you find out is because you're trying for a baby and you realize that you're not able to get pregnant, and then either scans or a laparoscopy pick up endometriosis in the form of scarring and scar tissue, as well as burnt and fresh spots where the lining, every time you have a period, the lining grows outside and it causes intense pain, and it can settle down. But for some people, they may have a high threshold of pain. So the first time you pick up, it may be when you're being investigated for fertility issues. But for a lot of people, they may be having painful periods for years, okay? And the pain may be that it doesn't respond easily to Nurofen or the non-steroidal anti-inflammatory drugs. Often the pain may be that is leading up to the period for days, for a few days before. These are all not set in stone, okay? So you can have any of these. You can just have painful periods in the first, second day. It may be a lead up to the pain. You may have heavy periods because of the way the lining works and causes inflammation. You may have pain in intercourse, and so you have infrequent sex because you're so worried of feeling sore. And you may not necessarily have pain deep inside just during sex, but it may be that you won't feel that much of pain then. You may have some discomfort, but you may be left feeling sore for days afterwards because you've stimulated all these inflamed tissue. So you can go from all these sort of symptoms, and you can have bowel symptoms. You may find that you have bleeding when you have your period, from your back passage. You may have pain when you're opening your bowels during your period because the tissue has also got inflamed. So, painful periods, heavy periods, pain during sex, pain during opening your bowels, having difficulty having children. These are all some of the symptoms. But sometimes you may not have any symptoms and it's only picked up on an ultrasound scan. And sometimes, Linda, you may find an accident and emergency. They will come in with an acute abdomen, sudden pain. And that's because they've had a big ovarian cyst full of chocolate material because they've been bleeding into it, and they've had painful periods, but they don't know why. And they've, either been reassured or they haven't sought help. And suddenly the cyst has leaked or had a massive bleed inside. And that's made them have severe pain. They've doubled up and they come to your department and we do a pregnancy test, is negative. And then when we do a scan, we find that they have these big chocolate cysts. And sometimes I have to do emergency surgery in that situation, but we don't want to reach that situation. But the other important thing about endometriosis to understand is there are two completely different groups. Initially, we thought that you started off with mild or minimal endometriosis. There's an American Fertility Society classification where you can have little dots of endometriosis, little black spots or little fresh spots, and that's known as mild or minimal endometriosis. And then you have a moderate or severe endometriosis, which is based on different classifications. How much of scar tissue do you have? Do you have cysts in your ovary that are full of blood? Do you have bowel adhesions or deposits on your back passage? So we know now that most women don't go from minimal and mild to becoming moderate or severe. Most women who are minimal or mild stay minimal or mild, and they just have very painful periods. But when you treat them, they actually have good success rates for fertility. While moderate to severe almost certainly start off like that, and they need much more aggressive treatment. They need much quicker help for assisted conception, IVF and things like that. So we don't necessarily believe that somebody from minimal or mild goes to moderate to severe. That has been my experience over, I would say, 35 years of looking after women. But it doesn't matter what kind of endometriosis you have. If you have symptoms, you need to be helped. You need help. You need to make sure that you get good quality of life. People often say, Dr. Bajekal, sometimes I feel it's easier to have cancer because people look at me and they look at, and see a normal, healthy looking woman and they think, why am I making a fuss? And they don't realize every single day is so painful. So, learning how to address the pain using all the other things, whether it's yoga or hypnosis or acupuncture, there is so many things that we can do to help women, but not taking them seriously, I think, is the most severe crime of all.
Yeah, and you've mentioned treatment for endometriosis and also treatment for PCOS. A lot of them are hormone based, aren't they?
Yeah, because remember, they're estrogen fueled conditions. Yeah.
And as most women who present with these the symptoms that would eventually be diagnosed as endometriosis or PCOS, a lot of them are in the reproductive age. And many are also thinking about starting a family. So actually having these hormonal contraceptive treatments or even be presented with surgery as an option for the treatment is not really ideal. So what advice would you give these women?
That's why it's so important to take a very detailed history. And in endometriosis, while for polycystic ovarian syndrome, you don't really need to do an internal examination and things. With endometriosis, it does help. How tender are you? If a person is willing, the physical examination also helps you, gather all your information. So you're like a detective. You're taking a very detailed history. And also you want to know what the patient's wishes are. What is your wish why have you come to see me? What do you want to go away with? Have you come for relief of pain? Have you come for relief of, or because you want to get pregnant? Have you come because, you think you may have endometriosis because your mother has had endometriosis? You want to take precautionary measures. So it's so important to know what the person is wanting out of the consultation. What is their aim? Because there's no point if somebody has got large chocolate cysts, if I'm going to tell them to only do lifestyle measures. Those cysts are not going to go away. All they're going to do is, and they want a child, for example, or even if they don't want a child, if they've got 7 centimeter big chocolate cysts, then that situation needs intervention. It needs surgery. But that does not mean they can't do lifestyle methods. But on the other hand, a young girl who's come and said, my aunt has endometriosis, my mother has endometriosis, I have painful periods, but I'm only 20, I don't want to have babies right now. What can I do? That is a person I would be talking about lifestyle measures as well as hormonal contraception. Because for a lot of women, having a pregnancy that is unwanted is not something that they're looking for. So it's really important to find out, are you looking for contraception? If so, what kind of contraception? And are you prepared to meet me and talk about lifestyle things, So I always start off with any of my consultations after I've taken the full history. I will always start off with, do you smoke? Because we know smoking can worsen endometriosis as well as polycystic ovarian syndrome because of the toxins glycotoxins that are there, increasing something called advanced glycation end products. So I will always ask about smoking. I will ask about alcohol. Then I will move to sleep. People don't feel threatened when you ask these questions. How do you sleep? Sleep is really important because sleep will tell me, are they stressed? Are they not stressed? What is actually happening? What kind of stress do you have? Are you in a relationship that's giving you stress? Or is it that you are in a job that having night shifts and all these sort of things? So is there something we can do there? So I talk about stress. So there are 6 pillars of lifestyle medicine, which I try and apply to the women's health as well. And so the first one I would be things like sleep, stress, use of risky substances, making sure, are they generally happy? Do they have a good social network? Do they have friends? Can they pick up the phone and talk to somebody? Are they able to have positive social connections? What do they do for a job, for a living, and things like that? what about exercise? Oh, I don't go to the gym. Well, you don't need to go to the gym. Actually, I can tell you that if you dance in your room for 10 minutes, that will get your heart rate up. And that's actually very good for balancing your hormones. So, finding out how much of exercise somebody does. Can you walk up the stairs instead of taking the lift? Can you go for a walk, instead of, or can you stand and walk around when you're talking to your friend on the phone rather than sitting down? So simple things to bring physical movement. So we've talked about exercise, we talk about stress, we talk about sleep, we talk about substances that are not very helpful. And then we also want to make sure that we are talking up. Then I bring food in. Okay. So the most important pillar, which is food, I tend to bring in so that people often feel very judged when you start talking about their diet. So I say, would you be interested to know a little bit more about how you can help your painful periods? And they say, oh, yes. So, do you like ginger? Oh, yes, I like ginger, or I hate ginger. So, if you hate ginger, you can have a ginger capsule. But otherwise, I'd say grate some fresh ginger into your tea and drink it every single day. But there are studies to show that actually if you put ginger into your, have 1/3 of a teaspoon or a pinch of ginger powder 3 times a day for 3 or 4 days of your period, you can actually help reduce period pains just as much as using Nurofen or Brufen. So once I say that, then they say, oh, okay. Then I ask them, how much of fruit do you eat? And they would say, maybe 1 fruit or 2 fruits, because fruits are bad for me because they're full of sugar. And then I explain to them that it has got fiber, and you can eat, the more fruit you eat, the lower the risk of diabetes, the lower the risk of endometriosis. The nurses' health study showed that, those who ate a large number of citrus fruits actually had the lowest risk of endometriosis. Those who ate a lot of beans and green leafy vegetables in the nurses' health study showed that they had the lowest risk of endometriosis. So, rather than telling them initially to cut out things, I tell them, from 1 fruit, can you make it 2 fruits this week? If you're eating an apple, would you eat a mango with some dark chocolate drizzled on it? And they say, ooh, I love that. Okay, would you mind adding a banana tomorrow? So, you increase it. So you meet them. If somebody says they're eating 3 fruits, you say, will you eat 5? If you eat 1, will you eat 2? So you slowly increase, Oh, I eat broccoli most days. Oh, will you consider adding some cabbage to it? And things like that. Or will you add some greens to it? So, oh, I don't like beans. Well, do you like baked beans? Oh, yes, I love baked beans. Will you consider having sweet potatoes with baked beans? Or would you consider having, baked beans on a jacket potato and eat the skin? And would you consider having a sweet potato with a chickpea curry or a cup of soy milk on your thing? So once you make it non-threatening and actually explain to them why it is so useful, and then you say, there are studies over and over again showing, especially in endometriosis, we know that red meat and chicken, red meat has a significant increase with endometriosis. Chicken and dairy, not so strong, but they were still significant in the studies. So, you want to say, would you want to consider, trying to get these out and crowding them out? So if you're eating this big piece of chicken, can you make it half? Can you make it quarter? And, but don't just leave the plate empty. Bring in color onto your plate. Bring in beans onto your plate. Bring in some turmeric onto your plate. Bring in some basil. What herbs do you like? So when you talk about these things, they feel much more open to considering changes. The moment you say, you've got to do this, and you start wagging your finger, this is really bad for you. No, I explained that women just have this certain amount of food that all of us can eat, which is, I think, between 3 and 4 pounds in a day of food. So every time you eat a donut, you're missing a chance of eating a big bowl of, frozen or fresh mango with blueberries on it and some dark chocolate. Every time you eat an omelette, you're missing the chance of having a nice, lovely tofu scramble or avocado on toast. Every time you're having, a porridge with cow's milk, you're missing the chance of having soya, which has got plant estrogens, or having a tofu stir fry, things like that. So you just put these ideas into people's head, and you will be amazed how open they are. And I then give them resources so they can go away and look at it. And I say, maybe just take breakfast and say, I'm going to change it. Maybe take breakfast and lunch in a week or 2 and see whether you can go a whole day, make it plant-based. So once they do that, they understand that. Then they'll say, oh, but I need something for my contraception. So then we talk also about, should they be on the pill? Will that be the best way of getting them? Should they've had children, should they be having the Mirena coil? It really depends on an individual decision. If people, because often when people say, I don't want to have change my lifestyle, or I don't want to have hormones, it comes from a place of fear. You have to explain why and how. Oh, I don't want surgery at any cost. Why don't you want surgery? Oh, because something happened to my aunt. So then you explain the safety of anesthetics and why they, in that particular situation, would benefit from surgery, while somebody who doesn't have anything, my examination is normal, she's young, she's fit, she's a little bit anxious about things. I'll say, why don't we do a trial and see how you get on? And then, because even after I treat endometriosis, I still have to give you something if you're not planning a baby straight away, right? Because every month you have a period, you're going to have exacerbation of endometriosis. So really is a very individual conversation based on what the person wants and what their symptoms are and what their tests show. Nothing is set in stone, but ultimate decision is always no patient. I'm there just to say, yes, you have large ovarian cysts, you would benefit from surgery, and they say, no, thank you, I don't want it. I understand that, but they need to have all the information before they make an informed choice.
Absolutely. Sharing the information and giving the power back to the patient and sharing the right information. Alina had a question about soya, and I would love to bring this to the forefront, because soya is always very controversial. And unfortunately, we hear a lot of soy bashing from different angles due to lack of understanding of what soya estrogens can do. Could you just highlight a little bit of the importance of consuming soya and why is it so beneficial for us?
Okay, sure. So, but Linda, let me just say that soya is maybe a 4-hour topic.
Yeah. Yes.
So anybody who wants to read more about soya should read up my fact sheet in my website called The Role of Soya in Men and Women's Health. But what I want to say very clearly, try to understand what soya is. Soya, the soya bean was about maybe 5,000 years ago, known as glycine max, was first discovered and grown in China. Okay, so it's a legume, and we know that legumes are one of the best ways of longevity, for living longer. Now, what soya bean has is something called isoflavones. These are plant compounds that have estrogenic activity, and the reason why people have suddenly got worked up about the estrogen is because they think it's the same estrogen that is floating around in a piece of steak or in our bodies. No, what it is a plant estrogen, which has much weaker activity than the estrogen that is floating around in our bodies. And the second important thing, soya is not the only place where you can find isoflavones. You find it in flax seeds, you find lignans in flax seeds and cereal, you find in blueberries and raspberries and all beans and soya beans. They all have isoflavones, which are, diazen and genistein and things like that. So these phytoestrogens that are there are really important to understand that soya basically works on just the beta receptor of estrogen, while the normal estrogen works on the alpha and the beta receptor. So what happens is in puberty, it will help to promote breast growth. But when your breasts are already, you've grown to your size, it will block those effects. That's why it works in breast cancer so well. In the bones, because of it has got something called the SERM effect, SERM, selective estrogen receptor modulator. Okay, so it is positive in some and negative in some, which basically means that it has a blocking effect in some tissues and a growth promoting effect in some tissues. So in the bone, it will promote growth. In the breast, depending on which stage of it, it will either promote or block the growth. So just like for menopausal hot flushes, it does the same thing. So it has got a very dual action, and it depends upon the level of estrogen when you started eating soya. So the earlier you start eating soya, and you need, as a child, you need 1 portion of soya, and that's not my handful or 80 grams. If you're a 6-year-old child, it's your handful of tofu or, a small cup of soya milk and things like that. So the earlier you start minimally processed soya, the lower the risk of breast and prostate cancer. That is the studies that are showing. But it's never too late. The most benefits for preventing cancer is earlier you start it. But otherwise, for all of us who are not used to eating soya, unless you're allergic to it, and remember, 20 to 30 people out of 1,000 are allergic to milk, dairy cow's milk, while only 2 to 3 people are allergic to soya. You may have allergic gluten, you may have soya sensitivity if you've had a very poor diet before and your gut has been damaged. But otherwise, most people can tolerate soya, and you want to generally go for the minimally processed soya, edamame beans, soya milk, soya yogurt, tofu, tempeh, miso, natto, while the soya sausages and the soya burgers should be had more as treats. And they're fine for older people and children because they need higher protein amounts. It's a very good source of protein. It's a very good source of fiber. And it also has these phytoestrogens, these isoflavones that are really very key for women's health and for men's health. So there's no effect on reproductive health. In fact, it can help in increasing the live birth pregnancy rate. It can help in polycystic ovaries with weight loss, with reducing cholesterol. It's high in the polyunsaturated fatty acids, which is a good type of fats to have. So healthy fats, healthy protein, healthy fiber, lots of vitamins, but also phytoestrogens. So it is good for reproduction for men's sperm as well as for women. It is good for cholesterol and heart disease and lipid profile. It is good to reduce the risk of cancer, but also liver cancer, colorectal cancer. So it's got huge numbers of function. If you don't want to have soya, it's not a problem. Don't have soya, but don't stay away from it because you're worried about it. And most people will benefit from having at least 2 portions in a day and probably up to 4 portions. The reason you don't want to have 10, 15, 20 portions is because you won't be able to eat the other 10 fruits and vegetables and rice and all the things that you want to eat. So you want to have a cup of, like I tend to have a cup of soya milk. I would want a cup of soya yogurt, maybe with some cashew nuts and a date. And I tend to have tofu or edamame beans or tempeh most days of the week. So 2 or 3 portions is what I would recommend in a varied plant-based way of eating. Thyroid, people often get very worried with thyroid. Now, the important thing to understand is that they both compete for the same receptors. So when you take your medication for thyroid, you want to take it about an hour or 2 separate from the soya. That's all you need to do. It's not a contraindication at all. But you also need to make sure that you have your thyroid checked if you are on medication, just like you would whether you are on soya or not. And iodine has to be supplemented because remember, our salt is not supplemented in the UK. So you want to take 150 micrograms of iodine for all of us.
Mm-hmm. And if we already talked about soya, we must talk about dairy.
Okay. What I think one has to understand is, why are we drinking the dairy milk? Whether it's goat milk or cow's milk, what is the purpose of it? If it's a source of calcium, you can get much more bioavailable calcium from your tofu, calcium fortified tofu, from your soya milk, from the green leafy vegetables, from the sesame seeds. So calcium you can put to the side because you can get it just as well, if not better, from others. But my main concern is if you're drinking dairy milk for calcium, you are also, along with that, ingesting, whether it's skim milk or full fat milk, you're ingesting high levels of protein. Animal protein has been linked as a cancer promoting, situation where the higher the amount of animal protein you have, it dials up the cancer genes. So you want to stay away because of the high levels of protein, the high levels of fat. And if you take out the fat, you actually increase the risk of breast cancer, if you saw from the China study. But also what dairy does have is insulin growth factor. And don't forget, 60 to 70% of the world's population are lactose intolerant. So you have bloating, you have all kinds of discomfort that you put down to all kinds of things. Every time I get a patient who will say, oh, I can't eat beans, it makes me really gassy. The reason they feel so gassy is because they don't have the good gut bacteria, and those gut bacteria that they do have in their bowel tends to be because of the amounts of cheese and yogurt and, Actionable or whatever they're having, because they think that those are probiotics and they're good for them, but they're not. So insulin growth factor, some of the hormones that are there, because you have to remember that cow's milk or goat's milk comes from a pregnant mother. So it's basically, it has got a lot of content in it that will make a small baby calf of 30 kilos to 300 kilos. And we are, average people, humans are a 3-kilo baby. So you're feeding something to try and really accelerate this growth with growth hormone and insulin growth factor. Is there any wonder why babies suffer from eczema, asthma, link of type 1 diabetes, and then later on, breast cancer, prostate cancer, bloating, probably even osteoporosis. So I don't see much benefit. Rather than bashing the dairy, I just feel bring in the healthy stuff. Forget the dairy. The dairy is a cruel industry. It is no good for planet Mother Earth. This is, Mother's Day, and Mother Earth is the biggest mother that we can think of. Why should we be consuming something that is hurtful as well as hurts our body, hurts the planet, hurts the animal? It's a no-brainer, I would much. And the other thing I want to say about soya, that only 6% of the soya is used for human consumption. The rest of it is for animal agriculture, for animal feed, okay, because it's so high in protein compared, it's very similar to animal protein, but in a different kind of way. So all these monocrops, these genetically modified soya that is grown for animal feed. All the soya that comes into the UK for human consumption is not genetically modified. It comes in from Asia. Most of the animal feed is grown in Argentina, Brazil, and the United States. So we have to know that biofuel and animal feed are the biggest reasons for soya growth. We who are promoting a plant-based diet are not responsible for the soya consumption of the world. It's a very inefficient way. The average British person eats 61 kilos of soya per year. And that is about more than a kilo per week, right? There are 52 weeks in the year. So that 1 kilo per week is fed to the animals, not to us. We should be eating it.
So dairy, cow's milk, does it also contain estrogen?
It does, but in not such high amounts. But the main problem is when you eat fiber-poor foods, which means eggs, fish, meat, chicken, dairy, junk foods, ultra-processed foods, they basically lack fiber. And fiber is really important for the liver and gut circulation, the enterohepatic circulation, where the fiber traps the excess estrogen and gets rid of it. So what happens is when that circulation is disturbed because of a fiber-poor diet, that estrogen gets fed back into the system. And so one of the theories is that it can increase the risk of all these estrogen-fueled conditions, endometriosis, polycystic ovarian syndrome. And there are a couple of suggestions to say that women who have endometriosis may have PCOS, and women who have polycystic ovarian syndrome may have endometriosis. I certainly see adenomyosis, which is a cousin of endometriosis, which is deep endometriosis, adenomyosis, fibroids, all going hand in hand. And then there's an increased risk of ovarian cancer later as well, and ovarian cancer has been linked to dairy as well. So really you want to reduce those risks by increasing fiber. And there is only one thing that has fiber, which are plants. Okay. So fruit juices are not your friend. Okay. Shop-bought fruit juices are definitely not your friend. You can have a small cup of fruit juice, no problem. But really anything that removes fiber is not good. And if you're having a smoothie, which I love, you want to sip it slowly so that you actually start off the salivary digestion and then you continue with that digestion. Because otherwise, ideally you want your body to do most of the work, but sometimes it's difficult if you're a small eater, if you're pregnant, if you're a child, to get in large amounts of green leafy vegetables and fruits. So sometimes smoothies are quite a nice way. And I like to have a smoothie a couple of times a week to, make sure that I get some of, extra boost.
Monica is asking about celery juice.
Yeah. So no, I would rather eat the celery with some hummus than having celery juice. I just think you're wasting that energy. You're throwing away the fiber. What is the point? It's fine if you, There's something called the Gerson therapy, where you do it for advanced cancer, where these patients go to the Gerson Institute and they have huge amounts of juicing as well as a whole food plant-based diet. That is to increase the antioxidant boost. But the problem is that if you're only going to do a juice cleanse or a juice fast, you're missing out on fiber, and it's going to cause insulin resistance with the peaks and troughs. So yeah, you can have green juices and all, but then you're missing out on the fiber. Fiber is probably one of the most important macronutrient I can think of. And I mean, you don't see the elephant, sucking on the grass and then throwing out the fiber. It eats the whole thing, so eats all the leaves. And there's a reason they do that. They're not squeezing out the juice. I just don't see any point in juicing. I think it's I'm very much against a diet. I don't like the word, for example, whole food plant-based diet. I think it's a whole food plant-based way of eating. That's what we are doing. You're actually encouraging people to bring color onto their plates. So citrus fruits, lots of fruit, lots of green leafy vegetables, lots of beans, lots of whole grains, lots of sweet potatoes and yam and tapioca and potatoes and herbs and spices and nuts and seeds. I want people to think it's a way of eating. There's no deprivation here. It's just joyful. You understand? So when people come and say, oh, you know what, Dr. Bajekal, I've been really naughty. I had a piece of cake. No, you want to have the piece of cake, have it. No problem at all. There should be no guilt attached to it. When somebody offers you something, say, I don't want to have it, rather than, oh, I can't have it, I'm on a diet. The moment you say, I can't, you are restricting yourself. The moment you say, I don't want to, you are in control. There's a very big difference. There's a very big difference when you say I can't versus I don't. And that is something that is so important to understand. It took me years to understand that when people would offer me chicken and things, and I would say, oh, I can't have it, when actually I didn't want to have it. I don't have an allergy. I was just a vegan for ethical reasons. And I just said, I should have said, I don't want to have it. Instead, I caused myself quite a lot of upset by saying, oh, I can't have it. Because I could. If I wanted to, I could. I just chose not to have it. So I don't want to have it. That puts you in a position of power. And that is so important. All the time saying you are important. Eating a piece of cake is not an issue. Moderation is not something I believe in, because I don't think moderation works. Your moderation is different from my moderation. Your moderation may be eating 1 biscuit a week. My moderation may be eating 5 biscuits a day. That's not moderation. I want us to just focus on the sort of foods. Every time you eat a donut, you're missing the chance to eat mango. Every time you eat a piece of fish, you're missing the chance of eating a big bowl of dal or beans or minestrone soup or spaghetti with a beautiful marinara sauce with lots of vegetables in it. And put your celery into that, make a beautiful soup or a beautiful spaghetti with a tomato sauce. Yeah. So I haven't had a chance to talk at all about polycystic ovarian syndrome, which is a very bad name for what should be called a metabolic reproductive syndrome, because it doesn't have the cysts on the ovary are tiny. They don't cause pain. They're empty egg follicles, but they don't have to be seen to have a diagnosis of PCOS. Okay, so that's important to understand. But what anybody who's listening can do is, first of all, you should track your cycle. It's really important that the number of patients I see who have no clue when their period comes, when it finishes, because if you don't know that, how are you going to know whether you are using, many more pads or tampons or washing your period panties more frequently than normal? So it's very important to know when your period starts, when it stops. So the normal cycle tends to be between 24 and 35 days. It should not last more than 7 days. So if you see a change that's lasting for more than 3 months, or you have bleeding in between your periods or after sex, it's really important that you seek help. The other important thing is that, so you track your cycle, you should be up to date with your smear test if you have ever been sexually active. You should be aware that the more plants you eat, the better you will help your health, whether it is polycystic ovaries, whether it's painful periods, whether it's endometriosis, whether it's dementia, whether it's heart disease. So try to bring in more plants into your life. And that is beans, whole grains, lentils, pulses, lots of fruit, lots of vegetables, lots of herbs, lots of spices, lots of nuts, lots of seeds. Really important. And make water the drink of your choice. Try to stay away from smoking and alcohol simply because they don't bring anything to the table. Okay. It's really, again, simple. Try to make sure that you move naturally rather than, it's fine if you're a weekend warrior, but try and get up every 20 minutes, every half an hour, stretch yourself, make sure that you can, stretch your muscles, because we're not evolved to be like this. Now, if you have symptoms of painful periods that are not responding to simple medications, if your periods are irregular, if you are having painful sex, if you want to plan for a pregnancy, if you are having excess hair growth, if you're having acne, especially hormonal acne, which occurs in the chins and the cheeks and this upper part of the neck, then don't ignore these things, because these are all features, and demand tests or demand information once you have empowered yourself. There's no point asking for tests without knowing what you're asking for. So go to the NHS website, go to the Royal College website, go to the up-to-date website, go to my website. Lots of information that have to be factual. Don't follow influencers just because they say, the pill is bad, or, having celery juice is great. I think what you need to do is come from a place of science, come from a place of facts, so that you can actually help yourself. That would be my advice. And really understanding the condition so that you can make the most. You only have one life to lead. You want to make it the best.
So we have to fight to get the right evidence out to our patients. And on Dr. Nitu's website that we have linked here in the chat, and you can find also will be on our website if you like Dr. Nitu to share the knowledge. These are the places where you want to go for evidence-based information.
I'm very active on social media, but I always warn people, that is not individualized advice. So really always make sure that you get scientific, good advice, and it needs to be kosher. It cannot just be because somebody said so, that's fine. It's the same. The soya is a big problem because of that. It's because of misinformation.
Absolutely. And there was a question actually about why do doctors advise not to take in soya? I think there's quite a lot of misinformation that unfortunately also gets to doctors as well. And this information is perpetuated.
Because, Linda, what happens is doctors, we don't get nutrition training. Okay, so we read our nutrition information from the same sources, the same tabloid newspapers that educate the public. So as a result, we are just as confused. I had to actually really spend time studying nutrition as well as doing, exams and things. So it's really important that, doctors should not feel shy to refer to nutritionists and dietitians who have done the degree for that. But sadly, a lot of dietitians and nutritionists are also taught by doctors who themselves don't know nutrition. But it's changing. And there are plenty of plant-based health professionals, as you know, is a fantastic resource, which I think you should link so that people can become members as well as follow this information from there. So there is so much good information out there now that, there's no excuse for any doctor to say they don't know, and no excuse for, and no reason for any patient or any member of the public to say that, because we can't have this 8 years to diagnosis. It's not, it's not right. It's not fair. We're letting our patients down. We need to help people, realize their full potential, and these conditions do cause a lot of distress, a lot of anxiety, a lot of stress, which is underestimated. Mental health can really be affected when you have these sort of conditions, chronic pain, you have severe acne, you have excess hair. These things really make a difference to people, how they perceive themselves.
And Dr. Nitu, earlier you touched on the point that, people might say, my aunt had endometriosis or PCOS, and very often we do see women who come in with symptoms of endometriosis or PCOS who have a family history of it. And if they are genetically predisposed to endometriosis or PCOS, does it mean that they will definitely get it?
No. So it's like heart disease, it's like diabetes. So Polycystic ovarian syndrome is a complex endocrine condition where you have genetics, you have environment, and you have metabolic factors. So just because you have a family history of heart disease or diabetes or polycystic ovaries or endometriosis, you can control the metabolic factors and the environmental factors. So just because genetics has predisposed you to something, and remember, these are all states of inflammation as well. So they're estrogen fueled, but also inflammatory conditions. Heart disease, diabetes are also inflammatory conditions. So that is why a whole food plant-based way of eating helps, because it reduces inflammation. There's no magic in it. It's because it reduces inflammation. When you do yoga or you do hypnosis or when you do mindful breathing or you walk in nature, your stress levels reduce. So what happens? Your inflammation reduces. It's not magic. It's science, I mean, science is magic, but what I'm trying to say is, that's what it is. And once people understand that, then it becomes more within your grasp. Just because genetics, like Dr. Esselstyn says that, genetics loads the gun, but lifestyle pulls the trigger, right? So just because you have something, it doesn't mean there's a study, even with the BRCA gene, the BRCA gene that causes breast cancer. We know that you can reduce the risk of developing breast cancer by 52% for women who went on a whole food plant-based way of eating. You see, so it's really, really important to understand the power. Just because your genetics says, and yes, genetics is important. Of course, it's important. That's how it decides why all of us can be on different. We are all eating plant-based, the three of us, but we will always look different, be shaped different, because that's the beauty of nature, that we are different human beings, So it's just important to know that yes, genetics has a role to play, but even more so is what is the power that what we put in our mouths and what we think and how we use, this time in our lives to actually empower ourselves. Because we are very fortunate and very blessed, aren't we? We're not having to struggle for food. We have a different kind of malnutrition.
Absolutely. And that's why we started the, afternoon tea session today.
That's fantastic.
Genetics does, they don't have to be your destiny, and there is something about it if we take control.
Yeah.
And then we have even seen that in your studies that every 3 months we can actually upregulate or downregulate 500 genes. So we actually have the control and the power in our hands to optimize our health to the best of what we can be.
Totally. And the other thing you have to remember is that, every single day, I cannot tell you how many patients I see, no periods for a year. They come to see me. I say, will you consider trying a plant-based way of eating? 3 months down the line, their periods are back. I mean, if somebody told you there was a drug like that, you'd be running for it. My husband has reversed or, completely controlled his diabetes just from a whole food plant-based way of eating. It doesn't work for everybody 100%, and some people will need surgery, some people will need hormonal medication. But as I said, every aspect of your life will benefit from lifestyle factors, the 6 lifestyle factors: nutrition, which is the strongest pillar; exercise, which is physical movement; making sure that you look at your stress levels and identify and find ways of managing it, because we can't get rid of all stress. Sleep, 7 to 9 hours, really important. Avoiding risky substances as far as possible, and having a positive social connection, really important. And to reduce our risk of cancer, we want to try and aim for a healthy body weight. That's really good. And we want to do that by avoiding risky substances like alcohol and smoking, by moving regularly, and by eating mostly plants. So, whether it's endometriosis, whether it's polycystic ovarian syndrome, whether it is ovarian or womb cancer or breast cancer, whether it's dementia, whether it's heart disease, which kills the most number of people, and dementia as well, it's the same diet. There's nothing different. The same lifestyle.
And what's really good about it and why it's sustainable is because people really start feeling really good. They start losing weight without even trying. It's not a diet anymore, but it's a sustainable lifestyle that people really love. It's just the cultural and the marketing that is kind of standing in between us.
Correct.
And also the knowledge on how to implement that. But that's why your work is so important to share that. And on Instagram, you share with your daughter, who is a dietitian, I believe.
Nutritionist.
Nutritionist, yes, but her recipes we follow regularly, and
I have lots of recipes on my website as well. So lots and lots of recipes. And the reason I try and do it oil-free is that there is no major benefits from a lot of oil. So for people who want to try oil-free, if they have diabetes, heart disease, yes, you can definitely add oil. But if you want to, it's also quite a dense source of calories. So I show people with cooking classes and things how, if they want to avoid oil, then they can. There is so much information out there, but information that should be from a reliable source. And I think it's the joy of eating. I'm a foodie, so I just love my food. There's not a chance that I would give up anything. And I'm so happy to have discovered this way of eating about 20 years ago. Well, most of my life I've eaten like this, but 20 years ago is when I committed.
Interestingly, I became a foodie when I went plant-based because the taste just became incredible. It wasn't just saturated fats and oils from animals that I was tasting, but it's incredible spices and herbs in every format, colors, fruits and vegetables, and just so much more than I have eaten before. So certainly a beautiful way of living, and it really works on all chronic diseases, which is why we know it's the right diet, because it has been shown, we know enough now to say, it's the healthy choice to go. And it's shown in diabetes, as you said, in endometriosis, PCOS, cardiovascular disease, to be beneficial. And what are the worst side effects? Well, that you have a delicious taste full of nice spices. So
I don't know if you know about the global burden of disease study. It was published in the Lancet, and it's about 15 or 18 years worth of following 195 people in 195 countries. And they found that what was much more important was how much fruits you ate, how much whole grains you ate, and vegetables you ate was more important than how much meat you ate or how much junk food you ate. So just eating these foods, that's why don't spend so much time thinking about what you're not eating. Just think about the things that you are eating. Bring those in. That is the way to do it, rather than thinking I'm giving up something. No, I'm actually gaining something. When you do that, can't versus don't. Remember, I can't have it is very different. I don't want it is very good.
I love that. What are we bringing in? Because every time when we are eating those other things and focusing on other things, then we are missing the opportunity to focus on what is actually the solution and what is good for us. Every time we ate a big steak, we missed the opportunity to eat a huge bowl of delicious, colorful vitamins, phytonutrients, phytochemicals, all the tasty things that our body needs to heal, and our microbiomes. And it just a win-win situation for all. This is a heavy topic, and where it can be daunting sometimes, but we would love to finish the interview on a positive note. And if you could share us a patient story or two that you found very inspiring.
Okay. So I recently had a patient with severe adenomyosis. Adenomyosis is a condition which is very similar to endometriosis, where the lining of the uterus, instead of just shedding, also pushes its way into the muscle wall. And so typically it occurs in your 40s. It can occur earlier, have very heavy, very painful periods. And a lot of women, if they don't respond to the Mirena hormone-containing coil, will end up with a hysterectomy because they have erratic bleeding, heavy bleeding, painful periods when having had years of no pain. So these women, often I do a keyhole hysterectomy and things like that. And I've had quite a few patients, but the most recent patient rang. So we were having a follow-up to decide about her surgery. And she said, you know what, Mrs. Bajekal, you mentioned that I should try and adopt a plant-based diet. I've been following you on Instagram. I have using all your recipes. And actually, can you take me off the list? And this was about a year ago. And now she does, so her periods got regular. She canceled her operation for hysterectomy, and her MRI scan actually showed such a big shrinkage of the adenomyosis. Now, not everybody's going to see that, but this is one of the stories. Another patient I had, a 39-year-old who I was doing a vaginal hysterectomy for a large prolapse, and she had been on insulin from the age of 17. She wasn't a type 1 diabetic, she was a type 2 diabetic, but from the age of 17. So she's already been 22 years. And in my casual conversation, I always bring in lifestyle. And so I spoke to her about that. And I just got, it's about a year and a half ago when I finished her surgery. And so she said about 6 months after she recovered from the surgery, her doctor took her endocrinologist took her off all her insulin. After 22 years of having been on insulin, she was off insulin. So, and now she was on medications, and she was hoping that she will wean herself off over that as well. But, when you hear stories like that, and she was a vegetarian, she wasn't even somebody who was eating red meat and things like that. So you can imagine the power of plants. So, if I had been 40 years ago, I wouldn't have believed this. I just wouldn't have believed it, because I couldn't imagine anything that was not pharmacologically based treatment. And so it's so empowering for me as a doctor as well to see these stories, no periods for a year or two. I mean, I've got so many case stories and so many patient stories on PCOS and on endometriosis, but, another time. But
that's incredible. Wow. So inspiring. And we hear more and more of these stories, and we read about them in research, in private, in conversations. They are truly what inspire us, especially here in Afternoon Tea as well, and to spread this incredible knowledge. It's simple, cost-effective. It just requires a bit of know-how and to get the family around it, so you can do it with your whole family. That's really important.
I mean, and age is this thing. I just had about a month ago, a 70-year-old who had come to see me for lichen sclerosis, which is a vulval condition. And during that time, she had been on insulin for 7 years. And 6 weeks later, when I saw her in my clinic, she was off insulin.
Yes. Wonderful.
I don't advise anybody to do this at home. It always has to be with the help of your doctor and things, not people like me. Although I'm a lifestyle medicine physician, I'm a gynecologist, I don't deal with the insulin side of things. They need to go and see their GP and their endocrinologist. But, even when you're 70, even when you're 80, there is no age, because you don't want to spend the last 10, 20 years in a hospital or hospice, not recognizing your dear ones. You want to really do all the things you can. And, how hard is it to eat blueberries and mangoes and, sweet potatoes and spaghetti and all the lovely, whole foods.
And actually, your taste buds change as well, and as your microbiome changes with the food that you eat, and your taste bud changes. For example, I never used to eat fruit. I love vegetables, but I was just never the kind of person who would go and eat fruit. And we've been plant-based now for a little while, and my husband and I were like, we crave fruit, and now we buy fruit every week. And just this morning, we both had a big bowl of fruit for breakfast.
Yeah.
So
the samosa doesn't taste as good. The mind keeps telling you, because, oh my God, the samosa will taste so nice, and the bhajia will taste so nice. And then you eat it and you think, oh, I feel sick. Bring that fresh bowl of watermelon, and then I'm going to be so happy, or this, broccoli, or the tofu steak, or whatever, So it is all a question of palate. What is one man's food is another man's poison, they say, right? So it's just what you're used to. And there are so many cultural cuisines that you can actually eat, Korean food, Chinese food, Indian food, Italian food. Oh my God. I mean, I can just go on and on, the injera and teff, which is the Ethiopian food, is just so delicious. And it's such a shame, we end our lives with just eating 3 or 4 animals and 3 or 4 vegetables, No, there are literally 200,000 plant species, and, we should be trying a lot of them.
As it's Mother's Day, we would like to make sure we don't take too much time of yours, Dr. Nitu. We are coming to the end of the hour, and we would love to ask you 3 practical, actionable takeaways for our audience, which are just simple 3 things that they should keep in mind. And after this, guys, we will stop the recording, and we'll take a few private, direct questions to Dr. Nitu, so that you can ask with confidence. And that's the point of afternoon tea, so that you can really feel comfortable with the clinician that we are talking to. So, Dr. Nitu, what are the 3 practical, actionable takeaways that you would advise us?
I would say, first of all, love yourself. I spent a lot of time not doing that. I think believe in yourself and love yourself. Do not feel guilty, especially if you're a woman or a mother. Take that time for yourself. And then when you have any problems, it will highlight to you and you can action it. So first is believe in yourself. The second is try to bring more color into your life. Yourself with positivity. If you have friends and family that drag you down, don't want them in your lives. You don't need those people in your lives. Surround yourself with positive behavior, so do community work, charity work, bring color into your plate, so lots of fruits and vegetables and things like that. And the third thing I would say is don't take anything for granted. So try to move, try to be physically active. You don't have to worry about going to the gym, but enjoy nature. Just realize that when you don't have health, everything fades in. It doesn't matter if you're a billionaire, it is not going to be of any use. So believe in yourself, bring color into your life, and make sure that you actually don't take anything for granted. That's all.
Smashing points. Thank you so much.
And so before we finish the recording, if you find this episode helpful and want to share it with your friends and family, it'll be available on YouTube very shortly. And you can also connect with us, as I said earlier, on Facebook, Instagram, and also you can join our free membership on the website so that you can connect with the community to continue this conversation and also to provide support for each other. As you learn about lifestyle medicine and if you want to make changes and want support, this is what we're here for.